Ever heard of Puppy Strangles? Well, it turns out that's what this much-loved pup named Harley had. But how was it diagnosed?
Harley came in for a recheck today. We saw Harley about 3 weeks ago now. At the time he was only 11 weeks of age, and he was a very sick puppy when we first saw him. He came in, he was very lethargic, he was off his food and extremely reluctant to walk. And this is a dog that normally tears around the backyard, typical puppy, chewing everything, eating whatever he can get his hands on. So the owner obviously was very concerned. When we looked at Harley, he was running a fever. He was very reluctant to be handled. Pretty much any joint that we touched or tried to flex, he would yelp. He was very protective of those. And when we felt his lymph nodes, so little glands under his jaw and in his armpits and in his groin, they were much larger than normal. Normally they'd probably be about 0.5 centimetre in diameter. And in Harley they were close to sort of 2.5 to 3 centimetres, so much larger than normal.
So what were the signs? Harley's mum Tracy explains.
All of a sudden we noticed one morning that he couldn't move his back legs. He was like dragging them a bit. Then we had to go out one afternoon and we came back and he was in exactly the same spot that we'd actually put him in, so we knew something was wrong.
This type of problem sometimes affects the throat glands in certain dog breeds, hence the rather scary-sounding name Puppy Strangles.
Yes, that's certainly one term for the condition. Another one that we call it is juvenile cellulitis. And it's a bit of a mystery condition at the moment. It seems to occur in dogs less than 4 months of age. One of the problems with it, though, is that there's no simple test for it. And so the only way you can sort of diagnose it is by exclusion of infectious diseases. And so certainly the last thing we'd ever want to do in a young dog if they do have an infection, and certainly we do see a lot of infectious diseases in puppies because their immune system isn't very good, is to suppress their immune response. And so it's very important in Harley that we ruled out any infections going on in him, which fortunately we did. And then we put him on some immunosuppressives, and he's currently being assessed today for a follow-up about 2 weeks into his treatment. And as you can see, he's looking very well. He's getting back to his happy self. He's not 100% yet, but he's getting pretty close. And I think if we were to fast forward another 1 or 2 months, his coat will be back to normal. He'll be off medication completely, and his owners will be very pleased.
So what do Tracy and Courtney think of the amazing Dr. Hugo?
He's wonderful.
Fantastic.
He really is good. Yeah, absolutely good. And I think that might be his first case of this as well. So he was very... he was trying to rule everything out possible before he had to put him on the steroid. So, and a lot of people haven't heard of it, so they need to be aware of it, I think.
These vets get excited at the most complicated
Oh,
things,
definitely, and they try to solve it as best they can.
And it wasn't till after that he was diagnosed that we noticed the rest of the puppy strangles came out, which was around the mouth. They lose the hair, the lymph nodes swell up, his eyelids swelled up so bad. Totally puffy.
Seems to be doing okay.
It's definitely back to normal. Yeah.
Yes. That's what we want.
Yeah.
That's what we want.